hospitals are feeling the pressure.
All these patients here sitting out in the hallways because we are full.
President Trump saying the government stockpile of equipment is almost out. And now some hospitals facing oxygen shortages. New York's Governor Andrew Cuomo warns the crisis could last for months.
This could go through the summer.
Now, both the U.S. Navy ship Comfort and that field hospital in Central Park already seeing patients trying to relieve the burden.
Breaking news. ABC News has learned the government is stepping up security around Dr. Anthony Fauci, the face of the nation's response to the coronavirus pandemic, as he faces growing threats to his safety.
Out of work. New record unemployment claims expected this morning as millions more Americans face layoffs, many of them struggling to secure benefits. Websites and phone lines are jamming. Top personal finance experts are joining us live how to navigate your family through this crisis.
Desperate to dock. Breaking new developments for those two cruise ships stranded at sea, with more than 200 sick passengers on board, now off the coast of Florida.
Breaking overnight, the mayor of Los Angeles now urges everyone to wear face coverings in public as the CDC waits making a new recommendation nationwide. How to make your own to avoid taking supplies away from those who need them most.
And as families all across the country face this disease, the emergency hitting close to home. George's wife, Allie, announcing she's tested positive.
So what started was I had a real tightness in my chest.
The latest on Allie's condition this morning and her message to the GMA family.
Live in Times Square, this is Good Morning America.
Good morning, America. It's great to have you with us here on this Thursday morning. We have a lot of headlines to get to, including one that's affecting the GMA family. And George, we are all thinking of you, Allie, and the kids, my friend.
Thank you so much, Michael. As I said yesterday, Allie started to feel some symptoms this week, and yesterday afternoon she did find out that she had tested positive for COVID. She's resting pretty comfortably right now, but as you guys all know, it is tough. The symptoms are really tough. She's getting through it. We're taking care of her. She's isolating upstairs, but she is so grateful for all the support she's received from all of you and everyone back home. And she wants to share a message a little later in the show to talk about what she's been going through and to share her gratitude.
But George, how are you doing? How are you doing with all this?
Okay, we're trying to manage everything. As you might imagine, I'm most worried also about the girls. So far, they're fine as well. They started their homeschooling this week, and they have really good attitudes, and they know they have to stay away from mom right now. They do even more FaceTime than normal, weather right now, but we're all doing okay, and we really appreciate all the good wishes.
Well, hang in there.
And it's going to keep coming, and we're going to talk a lot more about that. Allie sharing a very important message with our viewers a little bit later this morning. Dr. Jen will join us as well. But first, we do want to get to those new developments. Confirmed cases of coronavirus are now topping 200,000 here in the U.S. The struggle for healthcare workers growing as hospitals are pushed to the brink. Whit Johnson starts us off near that field hospital in Central Park, where they're now seeing patients. Good morning, Whit.
Robin, good morning to you. For many New Yorkers, these are images in the pandemic that will be tough to forget. Their beloved Central Park, the urban escape, now being used to treat patients with COVID-19. We know of at least 9 patients who spent the night here in those white heated tents behind me. That number only expected to rise as hospitals run out of space.
This morning, the mounting death toll in New York State alone topping 2,200, jumping by more than 650 in just 24 hours. Doctors on the front lines of the pandemic warning hospitals are increasingly overwhelmed.
This is our ED. You can see all the rooms are filled. Usually these halls are very neat and empty. And now you can see there's patients everywhere because of this. Makes it very hard to work, and we're trying our best to treat everyone that we can.
In this video provided by Mount Sinai, Queens, Dr. Matthew Bai taking us inside his emergency room, showing the overflow of patients, medical workers doing everything they can.
All these patients here sitting out in the hallways because we are full. All these patients in the hallway have all been seen. even though we're overflowing, or we're trying our best to still provide them care, which we are doing. You can see here that the patients have oxygen tanks that they need.
First responders also bearing a heavy burden. ABC News obtaining this alarming copy of new cardiac emergency guidelines given to public and private EMS teams in the New York City area, telling crews if they can't get a pulse on their own, they should not transport the patient to the hospital. The state now bracing for the possibility that the fight could continue into summer.
People say, well, when is it over? 2 weeks, 3 weeks, 4 weeks? This model projects you're going to have a high death rate through July. If this model is correct, this could go through the summer.
Amid growing shortages, President Trump saying the government stockpile of medical equipment available is almost out.
We're sending it directly to hospitals. We don't want it to come to the stockpile because then we have to take it.
According to the New York Times, FEMA has sent out about 7,000 ventilators across the country, but some states like California claiming dozens of those ventilators are arriving broken. The critical machines in short supply are keeping people alive. At New York Presbyterian hospitals, nearly 27% of their coronavirus patients are on ventilators. And now a new concern. Some hospitals reporting they are facing a shortage of oxygen because COVID-19 patients hospitalized in respiratory distress often require supplemental oxygen for breathing support.
The problem with oxygen at this point with the COVID-19 pandemic is that instead of having 20 patients in an ICU, hospitals now have 300 patients, all on ventilators, that are consuming oxygen 24/7. This is a demand that we've never seen before throughout the United States or throughout the world.
On Wednesday, an emergency field hospital with 14 tents and 68 hospital beds in the middle of the city's iconic Central Park began seeing patients.
We've responded internationally to Ebola. We've been outside of a war zone in Iraq. It feels very surreal to be on our own soil, to be here in the U.S., to see such a beautiful city impacted by this. But it doesn't change at all the need and our ability to help.
The NYPD reports about 17% of their uniformed members have called out sick. New York's Governor Cuomo says in a worst-case scenario, they can bring in state police and officers from upstate to help fill that void if needed. Michael?
All right, Whit, thank you. And hopefully seeing those images will let everyone realize just how serious this is and how important it is to stay home and make sure you socially distance yourself from others. And now we're going to turn to the new concerns about Dr. Fauci's safety. This morning, the government is stepping up its security as he faces threats. Our Chief Justice correspondent, Pierre Thomas, has the very latest. Good morning, Pierre.
Michael, good morning. Dr. Fauci has been the subject of online conspiracies claiming that he's fear-mongering and overstating the threat of coronavirus. One primary complaint that he's intentionally trying to undermine the president, something I'm sure Dr. Fauci would flatly deny. It's unclear if Dr. Fauci had any specific death threat, but apparently the U.S. Marshals and other security officials have seen enough. The recommendation for a security detail came after a request from the Department of Health and Human Services. Dr. Fauci is going to get, if he doesn't already have, a security detail of more than a half dozen federal agents. Yes, these are the type of people in black Suburbans that are heavily armed. These are crazy times, and I'm sure that with all the pressure Dr. Fauci is under, security is the last thing he needs to worry about. So these agents are going to do it for him, Michael.
And Pierre, just how fearful is law enforcement?
Michael, these are surreal times, and there's a feeling that unstable people, hate-filled people will do crazy things. Just yesterday, they charged a train engineer at the Port of Los Angeles with intentionally derailing a train near the U.S. Navy ship Mercy. Michael, he was, quote, suspicious of the Mercy and claiming it had an alternate purpose related to COVID-19 for a government takeover. You can't take chances with people like that out there.
No, you definitely can't, Pierre. Thank you so much. George?
Okay, Michael, thanks. We're going to turn now to the economic impact. So much of the country has been hit so hard, shut down right now, with millions of Americans laid off. And the new report on weekly unemployment claims is out this morning after last week's record job loss of 3.3 million. Rebecca Jarvis is tracking it all. And Rebecca, this week's report could be even worse.
It is eye-popping and staggering, George. Yeah, we've never seen anything like this before in history. So many job losses so quickly, but with 45 states now on lockdown, economists predict that we could see as many as 6 million Americans lost their jobs last week.
This morning, the country bracing for that new report on layoffs. Even the most conservative forecasts estimate at least 3.5 million more Americans filed for unemployment last week, the highest ever, eclipsing what was already a record 3.3 million filers 2 weeks ago. With so many across the country already struggling and out of work, phone lines and websites to apply for unemployment insurance are jammed.
This is probably going to be about my 30th time calling today. Let's see how it goes.
Welcome to the New York State Department of Labor Unemployment Insurance.
Juliana Calderon was a restaurant server in Long Island, New York, who tried to file for unemployment the day after she was laid off.
I have been trying to file for unemployment for about almost 2 weeks.
As the epicenter of the coronavirus pandemic, New York has seen telephone calls to the Department of Labor increase 16,000%. And web traffic up by nearly 900%. But the problems are prevalent everywhere.
I've applied for unemployment. I haven't heard back. Other coworkers, the same story. I guess they're overloaded with requests.
When we were furloughed, I immediately filed on their website, which took days, honestly, to file. Even just to get signed on took me 5 hours.
I am calling Texas Workforce Commission just to see if we can get through.
Economists warn the jobs picture will continue to worsen before it gets better.
We know that the illness and the contagion will get worse. We also know that the fatalities will get worse, but there's also fatalities in the economy. And that's what makes this crisis so unique and hard, is it's on all sides. We're getting hit on every side.
Time that for many like Juliana is running out.
I have decided to start weighing in the possibility of maybe applying to a local food store. I would prefer to stay at home, just as we are advised, but some of us don't have the luxury of waiting around for a check to come in. And I'm definitely one of those people.
And while you do not need to apply for those $1,200 stimulus checks, George, you do need to apply for that unemployment insurance. A number of states are working to upgrade their systems. They just were not prepared for this gigantic influx of people who have been laid off recently, George.
Yeah, never seen anything like it before. And Rebecca, so many people concerned, will their jobs come back once the pandemic passes?
And this is the key economic question at this point, George. As the pandemic passes, we know some business will come back and many businesses will work to get back to normal. But traffic, we're seeing it already in China, for example, as business is coming back there after they were shut down. Traffic doesn't come back immediately. That means employers who are still in business may not need the number of employees that they had prior to the crisis, prior to the outbreak. Then there's the second issue of who makes it through. And part of the stimulus measures are meant to keep businesses floating, keep them working through this crisis. But for many businesses, especially those small businesses, those 30 million small businesses in our country, keeping afloat for many, many months, George, is a tall ask.
Boy, it is just such a tough problem. Okay, Rebecca, thanks very much. And coming up in our next hour, father-daughter personal finance experts Dave Ramsey and Rachel Cruz are going to join us live with their advice on how to manage your family's budget. You can also find out more resources on our website. Michael?
All right, thank you, Jordan. This morning, coronavirus cases around the world are now approaching the 1 million mark. The UK experiencing its deadliest day on Wednesday, reporting 563 new deaths. And they've now announced Wimbledon is canceled this year for the first time since the Second World War. George?
Okay, Michael, thanks. We return now to that cruise ship nightmare. Hundreds of people are trapped on that from the virus circuit Zandam and its sister ship. It's now just off the coast of Florida, waiting for confirmation that they can dock. But even if they do, there's no guarantee that the passenger are actually going to be able to disembark. Gio Benitez has the latest with that. Good morning, Gio.
Hey, George, good morning. Yeah, the cruise line now says it has a plan to get healthy passengers off those ships. Now hundreds of people are waiting for approval in international waters. This morning, passengers aboard 2 Holland America ships off the coast of Florida are desperate to dock.
Broward County and the state of Florida, open up your doors and let these poor ships in. We have been through so much.
Florida Governor Ron DeSantis saying he will allow the 49 Florida residents on board to debark.
Clearly, we're going to be willing to accept any Floridians who are on board. My understanding is that most of the passengers are foreign nationals.
But more than 250 other Americans are on those ships, along with more than 1,000 foreign travelers. 233 people reporting flu-like symptoms. 4 passengers have died, including American Jeffrey Hagender.
These are human beings.
His niece Leanne speaking with us overnight. Her widowed Aunt Lucia still on board.
She's super isolated, and you can't properly grieve until you can hug your daughter and your son and start the process.
The passengers have been at sea for nearly a month, starting in Argentina and denied entry at every port. Now overnight, Holland America telling us it's proposed a plan, saying guests fit for travel would transfer straight from the ship to charter flights. But those unfit to travel at this time will continue to isolate on board until recovered. Florida officials have not yet approved that plan, but passengers say enough is enough.
Lives are at risk here on the ships. We don't want any more fatalities.
And again, Holland America telling us that it plans to keep sick passengers on board isolated in their rooms until they recover, George.
And Gio, what's the latest on when the ship might be able to dock?
So, George, we know that the captain has told passengers to start preparing their luggage. We know that the port has actually scheduled these ships to dock later this afternoon, but we just spoke with the cruise line, and they tell us that they are still speaking with officials about this, George.
Okay, Gio, thanks very much. Let's go back to Robin.
All right, George, thank you. Also this morning, something we wanted to share with everybody. We want to take a moment to honor the life of New Orleans jazz musician Ellis Marsalis Jr., who passed away from pneumonia caused by the coronavirus. Now, when you think of jazz in New Orleans, you think of the Marsalis family. That is the Ellis Marsalis Quartet performing at the New Orleans Jazz and Heritage Festival in 2012. He was a marvelous teacher as well, the first chair of the Jazz Studies program at UNO, the University of New Orleans, and he was a mentor to Harry Connick Jr. In fact, I remember talking to Harry about him. 4 of his sons also became musicians, including Wynton and Branford. Ellis Marsalis was 85 years old. He was a legend, Michael, pure and simple, quite a legend.
Absolute legend, Robin, and our prayers and thoughts are with the Marsalis family. Also this morning, we have much more on George's wife, Allie. She's going to share her story next, how she knew she had coronavirus, her symptoms, and she's going to let us know how she is doing now. But first, let's go home. Let's go to Ginger, who is at home. Hey, Ginger.
That's right. This is home. We're all home. Major spring snowstorm, Rapid City, South Dakota, just west of there, 11 inches. Severe storms possible in South Texas tomorrow. Let's get to the rainy cities now, brought to you by Walmart.
I've always seen your spark, your dedication and humanity. But today, as you're being challenged more than ever, I see heroes, not just to me, but to so many. Thank you for keeping us safe and for being our light, for always doing your part to make the world shine a little more bright. To our over 1 million heroes in towns across America, I say thank you.
Sunny skies to greet you this Thursday morning, this second day of April. It's cold out there this morning, even a little patchy frost west of D.C., but that sunshine going to help warm us up. Feeling really nice by noon, 54, but by lunchtime, starting to get a little breezy and kind of windy through the afternoon with high temperatures today right around 60 degrees. So it'll be breezy not only today, but tomorrow as well. The good news is we're looking dry heading into the weekend and tracking 70s early next week. I've got the 7-day forecast coming up.
We'll tell you that when we come back.